Welcome to today's video about early signs of dementia. Have you ever walked into a room and forgotten why you went there? Or struggled to remember a name that was on the tip of your tongue? We've all been there. But what if these moments are more than just simple forgetfulness? What if they're the early whispers of something more profound? Today, we're delving into a topic that touches millions of lives around the globe, the early signs of dementia. But this isn't just about memory lapses. Recent studies, like one from the Alzheimer's Association report, highlight an alarming rise in dementia cases worldwide. But there's more to this story than numbers and statistics. In our journey today, we'll uncover how these emotional shifts link to the intricate workings of the human brain under the shadow of dementia. We'll explore, we'll learn, and most importantly, we'll understand together. So, are you ready to unravel the mysteries of the mind and uncover the hidden signs of dementia? Stay with us as we dive deep into this crucial topic. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. Okay, time to dive into the early indicators of dementia. Kicking off with the first sign on our list, memory loss affecting daily activities. Memory loss that disrupts daily life is a key symptom of early dementia. This isn't just about forgetting where you left your keys. It's more significant, like forgetting important dates or events repeatedly. Imagine missing your best friend's birthday or your own anniversary because it just slipped your mind. In a 2014 study published in the Clinics in Geriatric Medicine, researchers found that such memory lapses, especially in recalling recent events or conversations, can be early indicators of cognitive decline. It's like pieces of your day just vanish. Now, we all forget things sometimes, but when it starts to interfere with your daily life, it's a red flag. Think about how frustrating and confusing it would be if you couldn't remember if you'd taken your medication or paid a bill, despite doing it regularly. This kind of memory loss is more than an occasional oversight. It's a sign that the brain is having trouble forming, storing, and retrieving memories, which is critical for everyday functioning. Next, number 2. Difficulty planning or solving problems. Changes in planning and problem-solving abilities can be subtle yet significant markers of early dementia. This symptom often manifests as a decline in the ability to follow a plan, such as a recipe, or manage tasks that require sequential steps. A study in the Dementia and Neuropsychologia, 2020, highlighted that individuals with early-stage dementia showed notable difficulties in complex task management. They might start to exhibit trouble in handling finances, like budgeting or paying bills on time. This decline is not just about forgetting, it's about the reduced capacity to organize, sequence, and prioritize actions, which was once done effortlessly. These changes are critical indicators, as they reflect alterations in cognitive functions directly linked to daily living activities. Next, number 3. Confusion with time or place. Confusion with time or place is a significant early indicator of potential cognitive decline. Imagine going to the grocery store and suddenly not recalling how you got there, or looking at a calendar and feeling disconnected from the date. This isn't just ordinary forgetfulness, like misplacing keys. It's about losing the sense of the present, which is central to our daily functioning. According to a study in the Canadian Pharmacist's Journal, 2017, individuals with early-stage dementia often experience disorientation in time and space. This isn't about the occasional mix-up. It's more profound, like mixing up seasons or being puzzled about one's location. This symptom can be particularly distressing, impacting daily activities and independence. So, when someone starts showing such signs, it's not just a moment of confusion, it's a cue to seek medical advice. Next, number 4. Trouble understanding visual images and spatial relationships. Visual perception difficulties are often overlooked, but crucial indicators of early dementia. When the brain's processing of visual information gets disrupted, it affects how one interprets their surroundings. It's not just about poor eyesight, it's a deeper issue of brain function. Imagine the challenge in recognizing faces, judging distances, or differentiating colors, tasks that were once automatic. A study in the Journal of Mental Health Research and Intellectual Disabilities, 2022, highlighted this, showing that these visual processing problems can precede memory issues. This disruption affects daily activities significantly, making driving or reading, which we often take for granted, increasingly difficult. Remember, it's about the brain's interpretation, not just what the eyes see. Next, number 5. New problems with words in speaking or writing. Language difficulties, particularly in expressing oneself or understanding words, are often early indicators of cognitive decline linked to dementia. As per a study published in the Materia Socio-Medica, 2018. These challenges can manifest as struggling to find the right words, substituting incorrect words, or using vague language. The research highlights how these issues aren't just about forgetting words. It's more about the brain's diminishing ability to process and retrieve language. This decline can be subtle, initially resembling normal age-related forgetfulness. However, unlike typical aging, these language difficulties progressively worsen. It's a symptom that's easily overlooked but crucial in early detection, as it significantly impacts daily communication and quality of life. Next, number 6. Misplacing things and losing the ability to retrace steps. Misplacing items and struggling to retrace steps are intriguing signs of early dementia, often overlooked in daily life. When the brain's hippocampus, crucial for memory formation, starts to deteriorate, it becomes harder to remember where things are placed. This symptom goes beyond typical forgetfulness. It's about putting items in odd places, keys in the fridge, for instance, and being unable to backtrack mentally to find them. According to a study in the Journal of Medical Internet Research, 2022, these lapses in spatial memory and reasoning are significant markers. They're not just moments of distraction. They reflect deeper changes in cognitive processing, signaling potential early-stage dementia. Remember, we all misplace keys sometimes, but if it becomes frequent and the reasoning process is affected, it's worth attention. Next, number 7. Decreased or poor judgment. In a study published in the Ames Public Health 2022, researchers found that changes in judgment often precede more obvious symptoms like memory loss. This can manifest as making unusual choices in social interactions, neglecting personal hygiene, or mishandling finances. For example, a person might start giving away large sums of money to telemarketers or overlook paying bills, actions they wouldn't have considered before. These changes are crucial indicators because they reflect alterations in the brain's executive functions, responsible for decision-making and logical thinking. Spotting these early signs is vital for timely intervention and support. Next, number 8. Withdrawal from work or social activities. When someone starts pulling away from their usual work or social activities, it could be an early sign of dementia. This shift often happens because they find it increasingly challenging to keep up with conversations or tasks that were once familiar. A study in the BMJ Open, 2017, revealed that social withdrawal can be linked to early cognitive changes, even before other symptoms become obvious. Think about it. If you're struggling to remember details or follow along in a conversation, social interactions can become stressful or embarrassing. This discomfort may lead people to avoid social gatherings or work responsibilities they once enjoyed, leading to a quieter, more isolated lifestyle. It's a subtle change, but a significant one to pay attention to. Next, number 9. Changes in mood and personality. Mood and personality changes in dementia can be quite subtle initially, but they're important indicators. Picture someone who was once easygoing but now gets upset quickly over small things. This shift often stems from the brain's frontal lobe being affected, impacting emotional control. A study in the Journal of the American Medical Directors Association, 2020, showed that these changes could precede memory problems, highlighting their significance in early detection. It's like the brain's usual way of regulating emotions gets disrupted, leading to these noticeable differences in behavior and temperament. Keep an eye out for these changes, as they can be crucial early warning signs. Next, number 10. Increased irritability, anxiety, or agitation. When we look at the early stages of dementia, changes in mood, particularly increased irritability, anxiety, or agitation, can be quite telling. It's not just about forgetting things. A study in the Frontiers in Neurology, 2021, revealed that these emotional changes are often due to the brain's declining ability to process information and handle stress. Imagine your brain struggling to make sense of everyday situations. It's like trying to solve a puzzle with missing pieces. This confusion and frustration can naturally lead to irritability or anxiety. It's a direct response to the brain's diminishing capacity to manage and interpret its environment. This insight helps us understand why recognizing these emotional shifts is as crucial as noticing memory lapses in early dementia. As we reach the end of our journey today, we've explored the intricate and often subtle early signs of dementia, going beyond the usual memory lapses to understand the emotional and psychological shifts that can occur. Remember, dementia is more than just forgetting things. It's about changes in behavior, mood, and the way we interact with our world. It's about understanding and empathy, but knowledge is power. Recognizing these signs early can make a significant difference in management and care. It's about providing support, love, and understanding to those who need it the most. If you or someone you know is experiencing these signs, don't hesitate to seek professional advice. There's a community and resources out there ready to help. Don't forget to like, share, and subscribe for more insightful content. Together, we can navigate the complexities of health and wellness. Until next time, stay informed and stay compassionate.